Okay, so this is uterus. Or female reproductive organs, that has a uterus, fallopian tubes, and the vagina. So perimetrium, let me draw it with the bright line. Okay, so this is the level of isthmus. Okay, and let me put the muscle from the cervix. Okay, this is myometrium, and I prefer to draw the endometrium with the color. Okay, so this is endometrium. I'm just showing that uterine artery okay, so this is uterine artery, the extra uterine part. Uterine artery enters at the isthmus. It perforates the perimetrium and then it go under the perimetrium and it ascends. This is one-sided. Go up to the middle. Then it gives the radial artery. Yeah, arcuate artery. Okay, the same thing happened on the other side. Okay, now from this arcuate artery, okay, let me label it. So this is uterine artery. Okay, and this is arcuate artery. Okay, let me draw here. Arcuate artery. Okay, and from the arcuate artery there is a radial artery that goes directly towards the endometrium, and I'm going to draw that radial artery from the arcuate artery. So arcuate artery makes an arc like this, and from there they produce okay, this is arcuate artery, and these are the radial artery. Radial artery directly travel through the myometrium towards the endometrium, and this is endometrium. So this is endometrial bed. Okay, this is endometrial bed, and from the tip of the radial artery, so there is spiral artery. Okay, there is a spiral artery, and when there is a proliferation phase, so this spiral artery makes branches and it gives more branches. Okay, so now look at here. This is spiral arteriole. This spiral arteriole and the secretory duct, the secretory glands, and the tunica functionalis all are shaded out during the period, and that's why there is a bleeding. Okay, so this is the full drawings of the uterine arterial supply. So this spiral arteriole is in the endometrium, and when we click the color on the uterine endometrium, and if there is a good enough circulations, we can see the color in the endometrium. We can also click the power Doppler to see the vascularity. Okay, it is very important to evaluate the arterial supply and its resistivity index for the uterus during its different phases to evaluate the fertility. Some people may complain, doctor, I'm losing my pregnancy every time. I'm having frequent miscarriages. What could be the cause? There are many causes. One of the cause is lack of adequate or optimum amount of blood supply to the endometrium. There might be some calcifications of the arcuate artery, radial artery. Radial artery can be compressed by the tumor. Okay, so there might be some occlusion, obstruction, compression of the radial artery on both sides. Yeah, uterine artery on the both sides. There might be some occlusion or compression in the internal iliac artery, the hypogastric artery. We have to understand that. Okay, so this arterial circulations is important for us, and we can easily see this extrauterine artery, and also we can see this uterine artery under the perimetrium, and with the high resolution good transducer we can see the arcuate artery, even though radial artery we can see. Okay, so that's the way we need to understand the arterial supply. Okay, one more thing. Do you think that if one uterine artery is inefficient to supply the blood in one side, so what's going to happen the other uterine artery? There will still blood from the internal iliac artery to supply the blood to the uterus. So, hemodynamically, the other side uterine or contralateral uterine artery will have more flow, even though may have more velocity. It depends on the total resistance. If the resistance is overcome, so then there will be a nice peak systolic velocity, normal range, but the flow will be increased because to compensate the blood to the uterus. It doesn't mean that one-sided uterine artery is occluded or agenesis, so uterus will be failure to conceive. No. The other side can, contralateral side can compensate the blood for the uterus. But make sure during the conception, the pregnancy time, this uterine artery can be or would be tortuous, dilated, and the flow will be very high, especially during the second and third trimester. Now, this uterine artery will give the blood to the cervix. Okay? From the cervical branch, it will supply the blood to the vagina too. Okay? This is cervical branch, CX branch, and this is vaginal branch. Okay? So as a whole, these organs are very well supplied of the arterial blood because they are their demand is very high. Their demand is very high. Okay, so this is arterial supply. Then what would be the venous drainage? The same venous name, veins will drain the blood into the internal iliac vein. Internal iliac vein will drain blood into the common iliac vein, and the common iliac vein will drain blood to the IVC. Now, as we know, the infection and the malignancy, they spread quickly by two routes: hematogenous through the venous return and lymphogenous, lymphatics. That's why we need to evaluate the the common iliac vein and the IVC for metastasis. If there is a primary cancer in the pelvic organ, we also need to check the IVC. Okay? So, venous drainage will be the same way, same reverse with the name change. Instead of artery, it would be vein. And finally, it drains blood into the IVC. Into the IVC. For this part. For the ovary, it is a little different. Okay, we will discuss the ovarian venous return. Okay, so now, lymphatic system. The lymphatic drainage is conducted by the internal or pelvic group of lymph nodes, and also the inguinal group of lymph nodes. When there is some pathology, suspicious infection or the malignancies, then you can see the lymph node close to the internal iliac artery and vein. There are some multiple lymph nodes enlarged, and the inguinal group of lymph nodes are enlarged. So this lymph node, usually or normally, it returns the lymphatic fluid to the para-aortic group of lymph nodes, and the para-aortic group of lymph nodes, they also have a connection to the porta hepatis group of lymph nodes. I said para-aortic, also paracaval too, around the IVC, around the aorta. And we need to check also the lymph nodes at the porta hepatis area, and then we need to check the liver. Okay, we need to check the liver for the metastasis. Okay, so these are the venous drainage and the lymphatic drainage of the reproductive system for the uterus. So now I will go over the supply of the ovary. Okay, so let's finish the ovary. Ovarian arterial supply. As we know that there are two ovaries. Okay? There are two ovaries, and it is by the side of the uterus. Okay? If I draw again the uterus, Okay, so ovaries are here, and as we know, the ovary is supported by the ovarian ligament. Okay, so these are the ovary. This is fallopian tube. So this is uterus. This is cervix, right? And this is vagina. The ovarian blood supply. There are two sources of ovarian blood supply. There are two sources. Number one source is ovarian branch from aorta. Aorta gives direct branch to the ovary, and another supply is ovarian branch of uterine artery. Okay, so ovary also gets blood supply from the uterine artery. So direct branch from the aorta and the branch from the uterine artery. The ovary, because of its ovarian cycle, it gives some tightness inside and relax inside. Especially when there is ovulation time, the density or the resistance to the ovary is less. And during the post-ovulation time, when there is a corpus luteum, the resistance in the ovary is less. There will be, resistivity index will be low. But in the periovulatory phase, the resistance is high. So we have to ask the patient when was the last period, so that we can calculate the ovulation time, periovulatory and post-ovulatory time, to understand the resistivity index. Okay, so ovary want to ensure its arterial supply from the aorta. Aorta has the higher pressure, it can force blood to the ovary even though its pressure goes little up. That's why one source is directly from the aorta, and another source is uterine. If one source is obscure or occluded, so that other source can supply the blood. As we know that ovary is a gonad. It has endocrine functions, and all endocrine gland in our body has more than one arterial supply and the venous drainage. Because the hormone needs to go, it's a ductless gland, needs to go to the blood directly by the diffusion. That's why vascularity needs to be ensured. Okay, so now can we do the arterial Doppler on the ovary? Yes, we can do. And it is very important to do the Doppler on the ovary to understand ovary is functioning normal or not. Okay, to understand also the ovulation is normal or not, post-ovulatory is normal or not. We need to check the corpus luteum too after fertilization. Yes, and also we need to evaluate the ovary. Is it strangulated or torsion or not, because a lot of young girls will come with a pain in the inguinal area or the lower pelvic area. Okay, then what could be the reason? It could be one of the differential diagnoses is torsion of the ovary. We have to rule out. That's why we need to click the color on the ovary to see its arterial and the venous drainage. Arterial supply, venous drainage. So artery is a pulsatile and the vein is non-pulsatile. So we can check on the ovary. Okay, so this is important to see the ovarian arterial supply. And ovarian venous drainage. Ovarian venous drainage is a little important that I am going to show it here. Ovarian venous return. Ovarian venous return on the right side, ovarian vein drains blood directly to the IVC, and on left side ovarian vein drains blood to the left renal vein. Okay, this is a board test question. This is exceptional things. Left renal vein, usually it is longer, dilated, and it has a slow flow because it carries the renal venous blood, adrenal blood, and in addition the left gonadal. But on the right side, the right renal vein drains blood from the right kidney, right adrenal gland, and that's it. But on the left side, additional is a left gonadal. Okay, so that's why if there is a cancer in the ovary on the left side, we need to check the left renal vein and also the IVC. Make sure we understand that. Okay, so this is venous drainage, and this arterial and the vein. So I hope we understood the blood supply to the female reproductive organs, mostly in the ovary, uterus and the ovary, and also the fallopian tube. It gets its blood supply from the internal iliac and also the uterine branches. Okay, so everything is